Hello everyone, let's try to solve this question together. So here we have a preterm infant who is placed on high frequency jet ventilator. Based on the chest x-ray, blood gas and ventilatory settings, the best action is to decrease the, so what do you guys think is the correct choice here? The correct choice here is decreasing the peak inspiratory pressure. Peak and expiratory pressure is given here, but that is, I'll show you later on, that's low, and rate and I time has a different mechanism in jet ventilator. We'll talk about it in a minute. So let's first see why we have to do that. So as you guys can see that the chest expansion, if you see here, you have a very flat diaphragm. This is one thing you have to consider when you're looking at the jet ventilator. See the CO2, the CO2 is low. And look at the settings. So here this 3 is the sigh breath, so you don't have to do anything about it. PEEP is only 6 and PIP is 20. The rate is 360 and the IE ratio is 1.37. So the point here is, whenever you have an hyper expansion just like it, so two things you can do. Either you can decrease the PEEP or PIP. But in this case, as you have noticed that the PEEP is already low, so the first thing to work is to work on PIP. Always remember that in jet ventilator, ultimately is the delta P that has to change. So you might have to touch the PEEP as well when you are weaning. But in this question, pertaining to this question, the specific answer was peak inspiratory pressure. So now, why not rate and I time? Just remember that, we rarely touch the I time because, usually the jet ventilator has a fixed inspiratory time, which is 0.02 seconds, and I will show you in the next. Actually, you can see it here too. Let me see where it is. Yeah, it's given here. See, jet valve time is usually, we fix it. So only thing to remember, we decrease the rate just when there is an air leak because we want to increase the exhalation time. Because if you have a fixed valve time, it's the rate that will decide your exhalation time. So C and D are usually reserved for air leak syndrome. So if you have an exam, a question and real practical scenario when you have like PIE, which is pulmonary interstitial emphysema, or you have a post pneumothorax case where you see the air leak, you should use the low rate and I time, which should be fixed, but the ratio should be high, which means that instead of 1.73, which you see here, IE ratio, it could be 1.9, 1:10, 1:12, but we don't go beyond 1:12 because you don't want to create a counterproductive effect of that. So now let's go to next slide, in which we have a reference. So you guys can see this is the from internet. It's a John Hopkins website, and you see it nicely talk to you about when to do what. So this is a nice table to remember. And like in this case, go to the second slide. See, you want to decrease the PIP to attain a normal CO2 because CO2 was low. So again, get familiarized with yourself with jet ventilator. Recently, we have seen more and more use of jet over oscillator. But again, it's the unit preference. Most of the time we have seen that when there is an air leak, jet works better rather than the oscillator. But oscillator ventilator is again a phenomenal ventilator. We have been using it without any problem. But this question was pertaining to the jet ventilator. So just read about it, see what you have to change with what blood gas and chest x-ray. So the point which I want to make here, whenever you put a baby on a jet ventilator, get an x-ray, see the expansion, see what type of disease the patient has, look at the blood gas, look at the CO2, look at the PO2, see which component need to be adjusted. Is the oxygenation, is the ventilation, and then basing on that, make a change, and always repeat a gas within 30 minutes to 1 hour to see if your change has made a difference. So I hope you guys have learned something together today. Please do like and subscribe to our channel, and you guys have a wonderful day. Bye.